Breaking now at 6, a crucial vote. An FDA advisory recommends emergency approval of the Pfizer COVID-19 vaccine. We're going to tell you what happens next and when the first doses could roll out here in the tri-state. That breaking just in the past 30 minutes. Thanks for joining us. I'm Natalie Pascarella.
And I'm Chuck Scarborough. It is impossible to overstate the significance of what just happened 20 minutes ago. An FDA advisory panel issued a recommendation that should be the long-awaited turning point in our long battle with COVID-19. The panel recommended emergency use of the Pfizer vaccine. That vote follows a full day of experts examining the data to make sure it's safe and effective for that emergency use. The FDA could reject the panel's decision, but that is considered unlikely. A thumbs up would mean distribution would begin immediately. The vaccine will be in many parts of the tri-state this weekend. The area's first shipment is expected to contain 330,000 doses, with more to follow. News 4's Rana Navini is live in the newsroom right now, tracking the latest for us. Rana?
And Chuck, in many ways, this was the last hurdle for the vaccine to get approval. This panel is made up of doctors, scientists, professors, and lawyers independent from the FDA. They have been reviewing the safety and efficacy of the vaccine, and they just said minutes ago that they recommend the vaccine be approved for use. The members voted on whether they believe the benefits of the Pfizer-BioNTech vaccine outweigh its risks for use in people 16 years of age or older. Now, there was some debate on including 16 and 17-year-olds in that recommendation. A few members saying that there's not enough information on that group and that teenagers are less likely to get seriously ill from COVID-19. But ultimately, the panel voted in favor of approval. So here's what happens next. We expect the FDA to issue final authorization likely tomorrow. Now, the FDA, as mentioned, does not have to follow the committee's advice, but it usually does, and we expect that to happen in this case. Once that does happen, the doses will be shipped to designated sites in each state, and then each state will enact its deployment plans.
And as we think about how we're going to get beyond this, a vaccine will be the primary way in terms of stopping the spread beyond the mitigation efforts we need right now.
Now, 4 members did vote against approval of the vaccine, but for the reason of including 16 and 17-year-olds in that recommendation. Reporting live in the newsroom, Rana Navini, News 4 New York.
All right, Rana, thanks for those late-breaking details. Now, as we said, in the city, officials say the vaccine could be here this weekend. Of the 170,000 initial doses of vaccines for the state, most of that's coming to our area. New York City will get the most in the state, followed by Long Island and the Mid-Hudson region. Today, bittersweet news in the pandemic fight, though. To get you up to speed here, take a look. City numbers surpassed the thresholds in 3 of the 4 major indicators. This is coming the same day that news broke of the city that a record of 500,000 tests in a single week. News 4's Andrew Siff live at LaGuardia Airport, where a new testing site just opened.
Arriving just in time for holiday travel amid the COVID spike, rapid testing right at LaGuardia Airport. This site on the ground level of the Terminal B parking garage.
If it's quick and easy, then yeah, it's great.
Not so easy getting 72,000 doses of Pfizer vaccine distributed once the vials arrive for cold storage in New York.
Shipments could start arriving over the weekend, but I think the first doses would be Wednesday or maybe even Thursday.
Mark Levine is chair of the City Council Health Committee, worried less noticed hospital workers like translators or cleaning crews might get skipped in the vaccine order. Whose responsibility is it to make sure that everyone in harm's way gets the vaccine?
So hospitals are deciding on their prioritization, and several I've spoken to are doing the right thing.
Mayor de Blasio saying the problem is the first batch isn't enough.
I'm very confident in the ability of our health department to distribute the vaccine effectively and all of our healthcare partners. The real question is going to be how many doses do we get each week?
Amid the waiting game, record numbers of New Yorkers getting tested, more than 120,000 in one day. Jessica Myers is a mental health counselor.
I am concerned. I think I'm more concerned with the number of hospital beds that are being occupied.
And others concerned new restrictions are imminent. The city's COVID positivity above 5% and rising.
It's getting worse. It is. It's honestly getting more dangerous as the day goes by. People aren't taking it as seriously as they should.
Meanwhile, we expect a lot of new information tomorrow from Governor Cuomo. First of all, on new restrictions. He might announce an end to indoor dining in New York City as soon as Monday, and also some detailed description of the vaccine distribution, which begins again in the city and around New York State next week. Reporting from LaGuardia Airport, Andrew Siff, News 4 New York.
All right, Andrew, thank you. New Jersey is set to get 130,000 initial doses of the vaccine, with more to follow. They won't come a moment too soon for New Jersey. Pandemic numbers have surged to levels the governor called alarming today. The state's positivity rate is now 13.9%. Essex County, the home of the largest city in the state, is hardest hit. The county has the highest case count and death toll. News 4's Brian Thompson is in Newark, where the mayor is suggesting a new statewide lockdown.
Mayor Baraka wishes a total shutdown across the state happened over Thanksgiving. Of course, it didn't, but with a new crisis looming of even more cases, well, he hasn't given up. Newark, a city that's been through several pandemic lockdowns since March.
To maintain a 6-foot separation from one another.
Police convoys repeatedly crisscrossing the city trying to enforce those lockdowns and curfews. The mayor here frustrated by Washington politics, looking forward to a new administration January 20th, lashing out at the current one.
Anything after this is hope, period. I'd have been happy if Mickey Mouse was the president besides this guy.
Mayor Ross Baraka can only be called an intimate briefing with a couple of reporters, so embattled by a virus that he wears a Newark versus COVID-19 face mask. But as testing continues all over his hard-hit city, and the state now worries that a worst-case scenario calls for more than 12,000 new positives a day in just a month across New Jersey. Local worst-case modeling calls for big increases here.
We were looking at maybe twice, 3 times what we saw in the beginning.
Minorities are in the majority here, a population that nationwide polling shows is most skeptical of vaccines based on past scandals such as the Tuskegee syphilis study.
We, black and brown people, most likely to get it and the most likely to die and the least likely to take the vaccine.
Hackensack Meridian, which will have several freezers ready as it receives some of the first shipments in July, acutely aware of equity issues, as CEO Robert Barrett tells me in this exclusive Zoom interview.
We'll make sure that if, as an example, if somebody's in a zip code where they're considered at higher risk, that they get to the front of the line, you know, as part of the process.
More than 18,000 positive cases to date in Newark, over 700 dead, including 3 reported overnight. A worst-case scenario for this city.
The hospitals would be overrun, obviously. The death toll would grow no matter how good we are in a hospital.
So Mayor Baraka will meet with 3 neighboring mayors in the next few days or so, and he says at that point he'll ask them, should we go to the governor and ask for a statewide shutdown? Something the governor has been reluctant to do. In Newark, Brian Thompson, News 4 New York.
All right, Brian, thank you. Taking a look now at the picture in the rest of the tri-state area. In Connecticut, a bit of good news. The statewide positivity rate is down to 6.6%, and hospitalizations are also down slightly. In New York, hospitalizations have reached 5,000, but the positivity rate is down to just over 5% now.